Pharmacies are well positioned in that transition of care for a couple reasons. And we're coming out of American Pharmacist Month and spent a lot of time in October talking about this. But at that transition of care, pharmacists sit in a lovely position because 90% of us, of the US population, live within 5 miles of a pharmacy. The access to pharmacists is absolutely great, but also we're a very trusted professional, ranked one of the top three, generally the top in the way of trusted. And so patients are coming in, they're having those rich conversations, but also we're taking all that rich data and putting it into one place to allow these slick workflows. And at Inovalon, we have an ambulatory surveillance tool that's in pre-sale right now. It'll launch to the market fully in 2026, and we're excited about it because this tool is leveraged really well on the hospital side for transitions of care. And we've built workflows that identify patients at high risk for hospital readmission. It's very costly to the patient as well as to healthcare in general. And if we look at some of those highest, you're talking congestive heart failure, COPD patients, cardiac issues, those patients can be identified and flagged. And then you pull in claims data, medication adherence data, and it allows you to intervene early as you're watching the patients through this transition. What can happen with medication reconciliation on those transitions? There are errors of omission where they're leaving one care setting to another, and that could be hospital to ambulatory or vice versa. Medications are left off of their regimen, and medications are duplicated in their regimens. And it's a real challenge when you're moving between settings because your formulary changes based on the care setting you're in. So in the hospital, the medications that they have contracted may be very different from your outpatient side of what your insurance wants you to be on. So those kind of errors happen very often. And then adherence is just a problem in general. Around 125,000 patients a year will die from medication adherence issues each year. And that's absolutely abysmal in the age that we live in. With the technology, everyone with smartphones, there are many ways that we can interact with patients in real time to help them stay on their medications or change their medications if the medications are causing the problems and they're not responding well.